Person-centered care, the care environment. Person-centered care is a view that all patients should receive healthcare that treats them with dignity and respect, while meeting their needs and wishes. It is an approach to the relationship between the patient and healthcare practitioner that focuses on the patient with the disease rather than the disease. Person-centered care has many varying definitions depending on the area of use. However, overall it aims to individualise each patient within the healthcare system by delivering meaningful and valuable care for the patient. This individualised and person-centered care is achieved by promoting care of the person, for the person, by the person, and with the person, according to McCormack.
Care of the person is reference to providing treatment using evidence-based practice and professional treatment processes. Care for the person focuses on the psychological needs of the patient. This requires care to be based on the needs, beliefs, and goals of the patient. For example, considering what behavior or language used to the patient is appropriate based on their cultural background, family condition, or patient's personality. Furthermore, by allowing the patient to be involved in decision-making, we promote care by the person. By allowing the patient to be involved in what services they receive is a prime way for the patient to express their needs, beliefs, and goals. To deliver person-centered care, a therapeutic relationship must be developed between the practitioner and the patient. This is known as care with the patient. By undertaking these steps, a care plan is created that is individualized to the patient's needs and wishes and respects their rights and opinions.
The key contributors to the person-centered care environment are involved: appropriate skilled, shared decision-making system, power sharing, effective staff relationship, the physical environment, supportive organizational system, and potential for innovation and risk-taking. Appropriate skill mix. In a multidisciplinary context, skill mix means the range of skill health practitioners possess and the advanced knowledge in specialized area to provide a quality service. Staff mix in nursing context involve registered nurse and non-registered nurse in the units. It is important as nursing work has been characterized in technical versus non-technical, direct versus indirect, skilled versus unskilled, acute versus non-acute, and urgent versus non-urgent. In order to achieve a more holistic person-centered care and deliver an excellent quality of care, appropriate skill mix is necessary to be applied in nursing context. This involves appropriation of the mixed qualifications and skills, the appropriate number of personal staff, and the balance of junior and senior staff members. Shared decision-making system. It is defined as organizational commitment to collaborative, inclusive, and participatory ways of engaging within and between patient and other healthcare practitioners. An effective workplace culture is prerequisite to facilitate shared decision-making system. Shared decision-making is important to provide many benefits for patients, clinicians, and the healthcare system. The individual-specific values which are explicitly shared in the workplace: adaptability, innovation, creativity, appropriate change, and a formal system of continual evaluation of learning are the attributes that build blocks to develop an effective team. Therefore, learning culture is an important lesson for each healthcare worker to establish a relationship with other people. Also, maximize practitioner potential and better understanding of the interrelationship between the team and the effectiveness of the patient outcome. This also helps practitioners to view their work as exciting and revitalizing, which offer them the prospect for both personal and professional growth. If nurses fail to learning culture at work, they are unable to develop relationship with others in ways that invalue the hearing of all voice and the engagement of all in decision making. The sharing of power. Power sharing is non-dominant, non-hierarchical relationships that do not exploit individuals, but instead are concerned with achieving the best mutual agreed outcomes through agreed values, goals, wishes, and desires. It is important as nurses are able to influence patients or family members in decision making. Therefore, work organization has to provide management or training that enables staff to negotiate the nature of that power in relationship with others, including patients and families. As person-centered approach makes explicit the need for autonomy, equality in relationships, and the centrality of beliefs and value in guiding decision making. Sharing of power greatly assists nurses to establish relationships with their patients about what really matters to them by putting the patient and family at their best interest to ultimately improving patient care outcome.
Effective staff relationships. What is it? Interpersonal connections that are productive in the achievement of holistic person-centered care. Why is it important? This is important because nurses develop positive and supportive relationships with patients and their family. While we nurture these relationships, it is often forgotten to also develop and encourage professional relationships within our team. In these professional interactions, the same level of standards, including the respect and value for a person, should be the same given to the patients under our care. If nurses fail to maintain and support these professional relationships, it will undeniably have a negative impact on the patient-centered care experience for the patient and their families. The physical environment. What is it? The physical healthcare environment balances aesthetics with function by paying attention to design, dignity, privacy, sanctuary, choice control, safety, and universal access with the intention of improving patient, family, and staff operational performance and outcomes. Why is it important? The physical environment has a strong importance to the care and healing of patients involved. Majority of healthcare environments tend to have a clinical and soulless setting, as they have been designed for a clinical efficiency approach, rather than person-centered careness. The aesthetic environment is a key consideration for a care environment, as ensuring there is an aesthetically pleasing space can promote healing, nurturing care, belonging, and sensory engagement. The argument from McCormick and McCann is with the introduction of single patient rooms that increases the patient satisfaction through the privacy and dignity gained in single rooms. Although this is based around patient-centered care, it does not consider the presence and visibility of healthcare staff available to multiple patients. Therefore, single rooms create a satisfactory care environment for patients, but are not effective for patient care. Supportive organizational systems. What is it? According to McCormick and McCann, supportive organizational systems promote initiative, encourage creativity, promote freedom and safety of persons, supported by a governance that emphasizes culture, relationships, values, communication, professional autonomy, and accountability. Why is this important? Support systems are essential and can have a significant impact on teams functioning within a wider organizational context, not just at a team level. According to McCormick and McCann, an example of an excellent support system is a magnet hospital, which are hospitals that work under a magnet recognition program that aims to support the staff in providing optimal nursing practices, professional development, and necessary conditions to feel empowered and supported to have involvement in the decision-making of their patients. There are 3 areas associated with their success that have relevance across the multi-professional team. First is administration that involves decentralized structures, flexible working, participant and supportive management style, adequate staffing, and well-prepared and qualified nurses. Secondly is professional practice, with professional practice models of delivery, associated autonomy and reasonability, availability of specialist device, and emphasis on teaching. And lastly is professional development through planned orientation of staff, emphasis on in-service and continuing their education, competency-based clinical letters, and management of development. These three areas for supportive organizational systems under the Magnet program are reinforced for staff to be recognized, supported, and involved in the decision-making process of their patients and the care environment. Potential for innovation and risk-taking. What is it? McCormick and McCann say that exercising the professional accountability and the decision-making that reflects a balance between the best available evidence, professional judgment, local information, and patient-family preferences. Why is it important? This is important because nurses' professional autonomy is a highly important factor contributing to a nurse's job satisfaction. It is argued by McCormick that it is essential for nurses to engage in an interconnected relationship with a patient through 4 processes in order to facilitate adaptation and decision-making. These processes create the foundation for innovation and risk-taking that can be utilized in a multi-professional context. First is facilitation of decision-making through using information sharing, combining new information into key practices, and established perspectives. Second is to recognize individual values and the importance it has on decision-making, and knowing how these values can influence a person's final decision. Third is making clear the intentions and motivations for actions, and the boundaries within care which decisions are set. Last is the development of culture care and the values it has on the patient's views for a legitimate basis for decision-making, whilst recognizing that the person does not always need to be the final arbiter of decisions.
Decision-making is a vital skill for nurses to take care of their patients and to communicate effectively with their colleagues. Shared decision-making encourages nurses to be reflective, think critical, be flexible, and to be confident in their decisions and when considering others. Leadership challenges can then become a problem as some nurses feel they don't have the authority to express their thoughts and plans regarding the person-centered care of a patient. It is important for nurses to consider the patient, family, and the community to ensure the decision they make is the right decision for not themselves, but for the patient's family, and the healthcare staff members. This can create a positive leadership challenge as it is important for nurses to consider all opinions and make decisions that encourage a person-centered care environment, and then put it into action. Clinical judgment plays an important part of decision-making and can present as a leadership challenge in the care environment. Other health professional members may disagree with other decisions, or vice versa, regarding the person-centered care which disrupts the decision-making process. Ensuring that decisions made are centered around the patient and is nursing interprofessional healthcare appropriate are positive approaches to the leadership challenge. Creating a positive work care environment can be a challenge as a leader, but a positive approach can be through effective staff relationships. A leader that encourages other health members to express others' opinions while showing that their opinions are valued is an effective building of staff relationships, motivating staff members to create a positive professional relationship with each other through communication and involvement in decision making. It is important to prevent care environment challenges as a leader. This ensures that optimum personal-centered care is being delivered. Continuing on from this lack of trust among nursing staff can present as a challenge for the leader. This is because staff need to know they can trust one another's skills. As a nurse, this equally provide effective person-centered care to patients through skills such as time management and prioritized nursing. If effective trust is not developed between staff, it can undeniably affect the patient's care. Gradient positive work care.
Innovations in healthcare directed towards improved healthcare outcomes, diagnostic and treatment options, as well as the efficiency and cost effectiveness of the healthcare systems, are frequently considered the result of information technology rather than the human factors. The need for nurses to seek unique roles that support a wide scope of practice and which fulfill gaps in health. Innovative and creative healthcare provided by entrepreneur and entrepreneur nurses across all health settings is one way of expanding the human influence of innovative healthcare. Wilson, Whitaker, and Whitford discussed about nursing entrepreneurship provides nurses with self employment opportunities which allow them to pursue their personal vision and passion to improve health outcomes using innovative approaches. A nurse entrepreneur offers nursing services of a direct care, educational, research, and administrative or consultative nature.
As such, the nurse is self-employed and is directly accountable to the client. For example, individual, private, or public organization for whom they provide services to. Such nurses may conduct an independent clinical practice, own a business, for example, a nursing home or pharmaceutical company, or run a consultant business, for example, education or research. Thus, nurse entrepreneurs are innovators who initiate incentives that lead to change, the modernization of health systems, and demonstration of leadership. Nurse entrepreneurs develop innovative health practices from within the organizational framework in which they work and consequently share the risks and benefits associated with the innovative practices with their employer. The type of innovations developed by entrepreneurs often involves efforts to transform workplace climate or culture, improve processes, or develop new products or services. Entrepreneurs are often motivated by the needs of their patients to identify gaps in services that can be addressed through the determined work of healthcare team that may or may not include themselves.